Hello, ladies and gentlemen. You're welcome to the chat with the Tycoon today. I hope you're doing all right. Today, we'll have a very interesting topic. Have you ever wondered what happens in the theaters, right? I have a lot of doctor friends, and sometimes they're like, "Oh, I'm in the theater. Don't disturb me. Don't trouble me." So today, we'll have an expert, someone that is experienced. We'll have a surgeon on here today. Tell us, just to explain to us a little bit what goes on in the theaters. Ladies and gentlemen, help me in welcoming Dr. AJ. Hello, AJ. How are you doing
Hello.
today, brother?
Hello, everybody. How's it going? You're right. I'm good. Thank you very much. It's nice to have me on in the podcast.
Yeah,
It's a pleasure to see you. Yeah. You're looking good, man.
you're welcome.
It's very good.
Thank you, brother. I mean, come on. I didn't expect you to start with flattering me already. We've just started.
Yeah. I have to say the
You're looking
obvious,
good too, my brother.
Thank you very much. Thank you. Thank you.
Yeah,
Yeah.
good. So I mean, I've known you for a bit, and what's happening. Tell us a little bit about yourself, AJ. Who is Dr. AJ?
So I'm an orthopedic doctor here in the NHS with years of experience in orthopedic surgery and general surgery. Yeah, I work in a very busy hospital here around London. We have one of the busiest A&E in the country, in London as well, probably third. And also we have a lot of trauma cases in our orthopedic department. So we have a lot of hip fractures. We do a lot of high volume hip procedures. So more than 50, let's say, in a week or in a month. So there's a lot of cases we do. Yeah. So that's why we place at the top. Well, we were one of the largest district hospitals around London. So what more can you get? The busy doctor's life.
Good. Yeah. Well, you already started selling me because you were starting to use some of those terms that trust
Yeah.
me, I do not understand. You guys have a very, very interesting job. Doctors, nurses, people in healthcare as a whole, because it's very, very critical, I would say. So well done to you for all your help. Well done you know, for everything you do for your patients, right? Because my
Yes, yes,
opinion is
yes.
that I don't think you guys would ever be paid enough, to be honest. Um,
Exactly. We sacrifice our time, our youth, and everything for the betterment of other people, and we deserve more than that. But what can you do? It's all about the passion, you know. If you're passionate for what you do, then you go for it, right? Yeah.
right. Good. So tell us, AJ, tell us about your desire to become a doctor. What made you to journey into this important profession?
So it started when I was in the secondary school. I was interested in engineering, but then I like biology as well, human anatomy. So towards the end of my secondary school, I had this struggle to choose what I wanted to do. So I got an advice to you know tune my passion for biology to something for the betterment of humanity. So medicine fits that role jigsaw. Then that's why I went for it. That's why I went for it. And I never regretted, looked back, and regrets about my decision. So it's been 10 years now, or more than that, in this career path. I'm enjoying it. Yeah, yeah.
That's good.
Why I chose surgery? Yeah, why I
Uh-huh.
chose surgery? Surgery is one field that I like. I like things to be more practical. So I don't like the sitting down and thinking processes about what do physicians do. Acute medical doctors. We call them physicians nowadays, but that's not something I would do or I like doing. So I like something practical, so hands-on, let's say, to keep it that way. So that's why I
Yeah.
went for surgery, and it's been my passion all this time. Yeah, I really enjoy
Wait,
it.
I mean, talking about good. You talked about the growing up there. Where did you grow up, and what was growing up like for you?
Yeah. So I was born in Nigeria, spent time here in the UK as well, and I went to med school in Europe, came back to work. Um, so I'm basically a resident doctor now in orthopedics, you would say. trying to be an orthopedic surgeon. Yeah. So,
So you're what?
so the challenges growing up would be mentorship. You don't have that mentorship. I'm the eldest son in my family, so there's no one to look up to for advice and stuff. So that was a bit challenging. So
Yeah,
if I had someone to guide me through, then that would have been better. But I had uncles that are doctors, so just that you don't
yeah.
have time to you don't have time to spend with them. Therefore, you don't have that contact, enough contact to maintain a good relationship and for a mentee-mentor relationship sort of thing. You get what I'm saying?
Hmm.
So, yeah, yeah,
Yeah.
yeah. That's it. Yeah.
Right. So,
Right.
Dr. LJ, so tell us about your specialty. So, I know that there are different types of surgeons, right? So, what aspects? What is your
Yes.
specialty, and why did you
So,
choose that area?
so my specialty is trauma and orthopedic surgery. So we deal with all kinds of fracture and musculoskeletal problems that patients have. So that could be fracture of the knee, fracture of the tibia, fracture of the radius, fracture of the spine. So we deal with all this kind of fractures and any musculoskeletal problems. Something to do with um, cervical dystonias and all that. So we deal with this kind of things. So that's what my specialty entails. But then why I chose trauma orthopedics is because I'm into sports. So I think understanding sports and trauma orthopedics. So I want to, juxtapose these two. That's why I went for it. Um, with the initial, or let's say long-term plan of, going into sports trauma orthopedics, where we're dealing with basketballers, people with ACL injuries, PCL injuries. So yeah, that's what I'm going for. That's what I went for trauma orthopedics surgery.
And you guys are also the ones that do MRI scans and all that. Yeah.
No, MRI is an exam we request for people that we want to examine, further. For example, we're suspecting that somebody has a soft tissue injury. Let's say he's got a pain here in the deltoid region. So there are certain things that can cause this. Maybe it can be because it's a muscle tear, the rotator cuff injury. So X-ray will show you if there's an injury of the muscle, but MRI is very specific. MRI shows you that there's an injury in the soft tissue or the muscle. So that's why we request MRI. So MRI is a diagnostic imaging for any pathological case that we want to discover or discern further. That's why we request for MRI. So MRI.
That's for MRI.
Dealt by a specific kind of doctors, with the radiologists they're called. Yeah.
All right. Okay. Cool. Yeah, interesting. Because I learned a lot about MRI because you know how footballers and young footballers. I know back in the day when I was in Nigeria, like when they're doing all these underage competitions, they would normally request MRI for those players just to determine if they are like to determine their age. Basically, I don't know how that works. By to check their bone and to know if they're actually on the age or if they're older. What's the dynamic around that?
So MRI is mostly for soft tissue injuries in orthopedics. That's what we use MRI for. So if we're trying to see if there's a tear in the muscle or if there's a collection of abscess in the soft tissues or if there's anything that we're not sure of in the CT, which is the computer tomography. When we do MRI, and MRI is more sensitive, it shows you the soft tissue injury, the tendon tear, there's a ligament tear, there's this, there's that. So MRI is more specific in that respect. That's why it's a gold standard examination in finding tears rather than X-rays.
All right. Yeah. Okay. All right. That's clear. So for the viewers out there that are wondering, maybe we should just take it back a bit and explain the types of surgery. So just I know there might be a lot more than you can tell us based on, you being the expert here, but what are the types of surgery? If you can just break it down for us and in maybe shrink it as much as possible. You don't need to explain like, we're not all experts and we're not all supposed to be experts. So you are the
Yeah.
expert here. So explain to us.
So to keep it simply, there are several bones in the body. You have bones in the forearm, bones in the legs, bones in the thigh. So you can have fractures in either of these sides. Depends on the severity of the fracture. The surgery depends on the severity of the fracture. Some fractures do not require surgery; they require conservative management, and other fractures require proper surgical management, followed by, let's say, physiotherapy on the other side. So if somebody has a fracture of, let's say, the forearm, what can we do? What we can do is, depends on the age. If it's let's say, the very young child of 9 years old or great. So fractures of the forearm wouldn't require surgery because they're still growing. And so we can just put a cast on and then you keep it there, immobilize it, and then it heals by itself. But in adults, you need surgery. So what kind of surgery are there? There's what we call open reduction internal fixation, where we put in plates on the fracture sites, and then it heals itself with time. That's a long process. So I would just keep it that way. There are many types of fractures and so many types of operations that we do. We do hip operations here in hospitals. Hemiarthroplasties, total hip replacement for people, or geriatric patients. So anyone above 70 years old. So in this part of London, there's so many cases like that. This is a very good destination for people to retire. So you have a lot of these cases here. So
A lot of falls as well, yeah? People falling over and breaking something. Yeah.
Yeah, they're very old geriatric patients, just fall. And then there's sustained hip fractures, and then you come here, operate on them, either total hip or hemiarthroplasty.
Yeah. All right. So, So, what does it take? What does this take? What does it take to be a surgeon? In your opinion?
It takes a lot. It takes combinations of skills to be a surgeon. Grit, perseverance, risk taking, ability to keep focused during the entire journey. There's a lot of distractions everywhere, but then if you're focused, then that's all you need. And also hand dexterity as well. In the theatre, you need dexterity of your hands to be able to do multiple things with your hands, have a 3D vision of what you're saying, good anatomy as well. Because as a surgeon, that's all you need. That's the basics. You need to know what is what bone is that, what muscle is that. You need to know all the organs in the body. That's what differentiates a layman and a surgeon.
Mm-hmm.
Exactly. So
the
anatomy.
All right. Cool. So then, basically, intelligence, right? You need to be intelligent because then, if you're not intelligent, you're not going to be able to know all the bones in the body, right? I mean, if you're not intelligent, like maybe like myself, I'm not sure I can know all the bones in the body.
When the word I can says I can do it, so it's fine. You can do
it. All right. So, what's about your experiences in the theater, right? Obviously, maybe you can start with explaining what is the theater for people who don't know, and then, like, on a general note, like, what are the experiences that you have every day? The constant experience that you have whenever you're in the theater.
So my experience would be we'll come in different things. So theater is a very interesting place. So you go in scrubbing, and then you have the patient prepared for you. The anesthetist come in, makes the patient sleep. Depends on what kind of anesthesia you want. So you can either do local. We have different types of anesthesia. There's local anesthesia, is general, there's spinal blocks. So most of the patients that go for orthopedic procedures have spinal blocks. Therefore, the lower extremity is paralyzed. The ones going for hip procedures, the lower limb is paralyzed, and so throughout the entire operation, they can listen to what's going on, all the noises from the hammers and everything. So they listen to it. So some patients sing in the theater, we discuss things in the
Hammers,
theater. So
mention hammers.
yeah. You know how hammers are clicking, banging everything all around.
Oh
You
my
feel
god.
it. The very dirty, the very dirty specialty. Some people say, yeah, blood's everywhere,
Yeah.
hammers, fragments, tissue all over the place. So good that the patient doesn't see it because how drapes around that protects them from seeing it. So they don't get scared. All they can hear is the noises. That's it. If they have seen it, that would be a different story. They'd be so scared.
Yeah.
Exactly.
Wow.
So now you can understand the sight of blood as well. Not everyone does. Yeah. So yeah, that's
Basically,
one part of it. Yeah, the patient sleeps and then we carry on with the procedure. After that, we clean up the site of the operation, suture it up, and then transfer the patient to the bed, and then they go to the ward, and then we continue with the care there. The physiotherapists come in, help them move, and then we discharge. So it's a very straightforward specialty. So yeah.
yeah. So those are the things that you do all the time. You must clean up and you must wear your scrubs and this scrubs.
Yeah.
What did you call it?
Yeah.
Get
Yeah,
ready
you
for
put
this.
on you need to sterilize. You need to be sterile. Put on the gowns and the hat,
Yeah.
the mask as well. And the mask needs to be with a shield, the plastic shield. Otherwise, bone fragments will get into your eyes, and then you won't be able to see again. So that's important in every orthopedic procedure. Yeah.
So out of all the experiences, out of everything you've seen, right? What's the one that left you most emotional? Just tell us about the most emotional experience you've had with the patient. Maybe the one, maybe a patient that you can't forget. That whenever you remember it, you're like, you just, yeah, you want to thank God, you want to cry, you want to do whatever. What's it that left you emotional?
There was a patient that died on the table. Actually, it wasn't long ago that died during the operation. We do know this patient won't survive much because of the comorbidities that she has as well.
Yeah.
Weak heart. She doesn't have a good systolic function, ejection fraction of the heart. So yeah, she basically died in the theatre during the procedure. That's the family got involved. They weren't happy about it, but it happened. Yeah. So basically,
Yeah.
tell you.
Well, I mean, I was gonna ask you. Yeah, well, yeah. Sorry about that.
Yeah, it's fine. There's no point continuing.
Yeah. Yeah. My next question was going to be if you've lost a patient before, but obviously that already answers that question. So how? Yeah. So how did that make you feel? Like what do you remember about that experience, and how does it make you feel when that happened? Because that's the extreme case, right?
Yes, exactly. I felt helpless, not able to bring her to life, and that this patient died on the table, and there's nothing we can do. Feeling the feeling of helplessness. Yeah, that's how I can describe it. That you can't help but come back again.
Yeah.
But we'll try what we can do. We couldn't save her. She passed out.
Yeah.
Fortunately.
Yeah. Well, may her soul rest in peace. Right. So we're gonna bring it out from like the experiences now on in the theater, and then just talk about maybe medicine as a whole, being a doctor as a whole, and like what you can. I'll start with what you can pass on and what you. So what would be your advice then to aspiring doctors? Aspiring doctors, surgeons, and and what are your thoughts on them as well?
So my thought is, if you're an aspiring surgeon or you want to go into surgery or you are doing surgery, is to keep going. You're in the right direction. Just believe in yourself, believe in God, keep working hard, just be persistent. It's not gonna happen overnight, but it will still happen. 10 years, 5 years, 20 years down the line, you're gonna be where you're gonna be. So you can't, you know, rush through. It's a process. So enjoy the process. That's the most important thing.
Right.
Yeah, that's my advice.
Yeah. All right. So, yeah. Well, the next question that I have for you is: so, what are your thoughts on artificial surgery? We see like body enhancement surgeries that are not necessary, but people want them because they want to look a certain type of way, or they want to express themselves in a certain kind of way. What are your thoughts on this kind of work?
That's a very difficult question to answer. But people are capitalizing on people's insecurity, which is an ethical question that we need to answer as
Yeah.
well. Yeah, it's an ethical question. So you capitalize on people's insecurity to make money. So surgery is an addiction for most people. It goes from doing your buttocks to breast surgery, and then you keep doing it. Paying your doctors children's school fees rather than investing in yourself. But I think people should learn to appreciate how they look, and who they are. To have a self confidence in themselves. But going back to whether it's the right thing to do or not is a very tricky question, because patients would want to look a certain way and they're going to ask to help them. So there are doctors that are specialists in the plastic. So that's their job. So they will have to do it. But then it comes at an expense, at a cost. Well, some people got on to disfigure themselves from who they were before to something different. By the words sometimes, which is a very there's a balance. There's a balance with respect, I would say.
It's good you talked about the ethics part of it as well. Because I will say to you, I'm an accountant as well, and as much as the accounting bodies want to talk about the ethics of the profession, no creative accounting, no this, no that, no that. Auditors should be independent and all that. And then I wonder, how really can an auditor, for instance, be independent when they went in for a job, they bidded for a job, and then there are other people as well that wanted that job, and then you got it, right? And you're being paid by this person that you're supposed to be independent over. Can you see that there's an issue there? It's just like you said there as well. Doctors, someone comes to you, oh, I want my boobs to be bigger. I want to do a BBL. I don't like the way I hope you too, doctor. And you're seeing the money. I'm going to pay you this amount. So can you see the balance there with the ethics and the the money aspect of it?
Exactly. There's a disbalance there. So it's left for the medical ethic area of medicine to discuss about that. Doctors need to be involved in the panel anyway. But I think it's for me, I think it's unethical in a way. To take advantage of people's insecurity. And people can see that. You have a patient comes back again. They want this. It's like an addiction. An addiction.
Yeah. So then the way after talking about X and everything, so would you then do these things? Would you do those kind of surgeries for people, those artificial surgeries, if if you were in the position, or if is it something you can do? Because clearly you do not agree with them. You just said that you want people to appreciate themselves. Yeah. So would you do it?
Yeah, exactly. That's why I'm not. That's why I'm not in that specialty in the first place. That's why I'm in orthopedics, to help who they want. Like, I help people that need it, basically. Yeah. not for aesthetics reasons, but for preventive or let's say surgical prophylaxis in a way to help them cure the pathology they've got in place. Yeah. So that's why I'm in this area. Surgery.
All right. So yeah, well, I think we actually fused in the business side of it because the artificial surgery industry is a multi-billion-dollar industry. So
Big market.
then my next question was going to be about the business side of things. What do you think about the business side of things? Of this
Right.
whole thing.
Business side of things, you mean clinical practice. So, like even orthopedics, you can have your clinics. So in your clinics, that's where your money comes from. Let's say side money. You can work for the NHS and then have a private clinic where you work at, which can bring you, money on both sides. That's a business side of it. You can work with multinationals like Johnson to help them sell their products like surgical, traumatology, equipment, all that kind of thing. You can go into that area as well if you want to, or sell these products as well to countries in need, partnership and all that. That's an area that can go into if you're in my field of surgery. Yeah, but I think there's a lot of business opportunities to make money from as well. Yeah, depends on what you want. Is it the money or the passion? But I mean, money comes first.
Right. Okay. So, I was gonna ask this bonus. Right. I was gonna ask this bonus question. So personally, I know obviously there are the normal things you do, wear your uniform and everything for the surgery. So, a bonus question is gonna be personally, emotionally, and in terms of your mindset and everything. How do you get yourself ready for a session? You have a session with a patient, let's say 5 p.m. today or something. How do you prepare yourself mentally for it?
Right.
Is there any special things that you do?
There's no, because I like to speak to people. So once they come in, it's a natural conversation I have with them. I don't talk to them in a way that makes it very professional and strict. I make sure they're relaxed and there's a formality in it as well that I chip in to speak to them. So I don't make it really formal. So that makes them relax and I'm relaxed myself as well. So you make it like a conversation about themselves, and then they're more likely to open up. So you establish a very good relationship. So I don't have a mental preparation. Just like I'm speaking to you, that's how I speak to my patients. We laugh and talk. Yeah, we laugh and talk. So right. I don't be very strict and formal, but I keep a balance between the two.
Yeah. Okay. All right. Cool. So I mean, we're close to the end. So, but we just have a few things to run through before we. We'll have a few quick fire questions. So there are 2 questions, quick fire, just random. There's no wrong answer, but then there's a right answer. Sorry. So yeah. So the first question is going to be. Which country has the most plastic surgeons in the world? I think this is an easy question. What's the answer to this question?
That's a very easy answer, isn't it? Like, you can say Brazil. I'll say Brazil.
Brazil?
Yeah.
Brazil?
People have a lot of BBLs there, Butt lifts, Brazilian.
Well, actually, Brazil is number 2. Number 1 is the United States of America with 7,750 as of 2023. Yeah. Brazil is second with 6,407. I mean, I always thought it was going to be the United States anyway. But
yeah, I was thinking the same, but I was thinking BBL, like people go there a lot, a lot. But it's not a big difference. 10,000 is a big difference, so it's not. that much. I think the market in Brazil is booming as well. So many people go there for that procedure. It's a cheaper alternative to America, so people fall for that.
Yeah.
Procedures are very expensive now. So people,
Yeah. We'll have a second question. Don't forget. So the second question is, how long was the longest surgery in the world? So the longest surgery, how long did it take? How many minutes or hours or days or whatever? How long was it? And if you can remember where as well, that would be nice.
yeah, I'm trying to remember the days for this, hours for this. It's one that I think a day and a half.
No, no,
No,
doc, no, doc, no, doc,
so
no,
which
doc.
one is
So
that?
according to our AI, Google AI, the longest surgery in the world was 103 hours. That's about 4 days. So it was in
4 days.
2001 at Singapore General Hospital, and the surgery
Wow.
was performed on conjoined twins and involved refashioning their skulls and dividing
I,
hundreds of blood vessels in their brains. The operation was led
it
by
was
Dr. Kit
it
Gore,
was
who
the same
used virtual
procedure I was
reality.
thinking.
Yeah, yeah. So,
I was thinking
and it
about
was
this
on kids.
procedure as well because
Mm.
there's a procedure that was Ben Carson, if you know. You know
Hmm.
Ben Carson? He's an
Yeah,
American
yeah.
neurosurgeon. He did the first operation of Siamese twins. I was thinking of this procedure he did.
Mm.
I think he did another one in Singapore. I think he was called upon to do it in one of his Asia countries. But the thing, I'm
Mm.
not sure how long the procedure was. So. But it's
Yeah,
just it's good knowledge. So yeah, I learned something
yeah,
today.
yeah, yeah. No, no, no. Of course. We learn every day. It's all good. No, yeah. There's no pass or fail or anything.
Exactly.
Right. So, yeah, just for us to wrap up, then, is there like what's going to be your parting words for people out there who want, yeah, anyone listening to you? What's going to be your parting words to them?
Yes, keep working hard, believe in God, do what you're passionate about. It's not all about the money. Uh, if you do things for the money, it comes out. People see it, the desperation, which is not what people want. Do it for the love of it, and then the money follows. Yeah, that's
Right.
what I have to say.
Well, I forgot something. There was something I forgot. So before you go, please tell us what are your thoughts on BBLs? What are your thoughts? Do you like them? Is it? Would you like to perform a BBL on some patients someday? And generally, I heard it's one of the dangerous ones out there, right? One of the dangerous
Yeah, yeah,
procedures out there, but still a lot of people
yeah.
do them.
People
So
do
what
it.
are your
People do it.
thoughts?
It's a very dangerous procedure. I wouldn't do it on a patient. I'm not in that specialty to do it, so I'm in a different specialty. I wouldn't say I can do it or not, but the fact that I'm not in plastic surgery, I can say my mind. I wouldn't, I wouldn't do it at anyone. Um, just like I said, I like people to be comfortable in their own skin rather than trying to do something else. But I mean, the media portrays women's insecurity, makes them look, the ideal standards of beauty keeps changing every day. So women are trying to, they're pressured to be something they're not. It's not good.
Yeah.
It's the world we live in. Indeed. But thank God I'm not.
That's a good way to that's a good way to go away from answering that question. Anyway, thank you very much, Dr. AJ, for being
Thank
with
you very
us
much.
today. We're gonna put a link to all your socials on the description below. You have your own podcast, you were telling me. So can you tell us about this
Yeah,
podcast and if you
it's
want
a
people
unique.
to have a look at it?
Exactly. It's called the Unique People's Podcast. I invite, notable people to talk about certain things, and I talk about certain things that are important in society. Um, more about self-awareness, mental health, science, technology, all kind of things that you can imagine. I talk about latest issues in society that needs to be, tackled. I talk about my career. I talk about, so many things. So just please join me, subscribe to my channel. There's Unique People's Podcast. You can find me on you can find me on Spotify as well. So yeah, just look it up and have a look. And if you're interested in coming in, you can join me in as well. I can post you in.
Yeah. Anytime,
That's
anytime, bro. Right. So yeah, well, obviously you can be here while I do the pattern shot. So guys, thanks for watching the video. Please subscribe to the Unique People's Podcast. Check out Dr. AJ on his Instagram and everywhere. We're gonna have it in the description below. And as well, subscribe to Chat with the Tycoon as well. We're growing, guys. We're growing, we're moving, you know. Join the moving train now. Before we leave you behind. So thank you very much. See you next time. God bless.
Thank
Bye.
you very much. Bye.